Most people think gut health starts in the stomach, but that's already too late. The real beginning of your digestion, your immune signaling, and even your inflammation levels starts right here in your mouth. Your oral microbiome is the very first barrier that decides whether your body will live in a state of healing or a state of constant inflammation. And every single day, often without realizing it, people are damaging this delicate ecosystem with exactly the things they believe are helping. Chemical-filled toothpaste, harsh mouthwashes, sugary foods, snacking all day, dehydration, even aggressive brushing. These habits strip away the protective bacteria designed to defend you, activate enzymes that trigger inflammation throughout the body, and open the door to gum disease, leaky gums, and eventually leaky gut. When you disrupt the oral microbiome, you don't just get bad breath or bleeding gums, you disrupt nitric oxide production, which raises blood pressure. You destroy the bacteria responsible for starting digestion, which increases bloating and acid reflux. You weaken immune signaling, leaving you more vulnerable to infections. And you allow oral pathogens to slip into the bloodstream, where they contribute to heart disease, cognitive decline, fatigue, and high inflammation. In other words, if the mouth isn't right, the body cannot be right. The good news is that the mouth also heals remarkably fast when you stop assaulting it and start feeding the right bacteria. And that is what I want to show you today, the number one, science-backed oral care routine that restores healthy bacteria in the mouth, reduces gum inflammation, supports nitric oxide production, protects the gut lining, and improves whole body health surprisingly quickly. This is simple, it's cost-free, it's biologically logical, and it's the foundation every single person should put in place before they ever attempt to fix gut issues, fatigue, or chronic inflammation. The oral microbiome is the very first biological community your body relies on to keep you alive, well, and functioning. It is made up of more than 700 species of bacteria, fungi, and enzymes that work together not only to protect your mouth, but to regulate systems far beyond it. These microorganisms are not passive passengers. They are metabolically active, constantly communicating with your gut microbiome, your immune system, and even your cardiovascular system. What happens in the mouth does not stay in the mouth, it sets the tone for your entire health landscape. When the oral microbiome is balanced, digestion begins properly, inflammation stays low, the immune system gets accurate signals, and the gut lining stays strong. When it becomes dysbiotic, everything downstream begins to unravel. Healthy oral bacteria act as your first line of defense. They neutralize incoming pathogens, break down food efficiently, and initiate digestion long before food ever reaches the stomach. These bacteria convert dietary nitrates from vegetables into nitric oxide, a signaling molecule essential for blood pressure regulation, circulation, mitochondrial energy production, and immune function. Without a healthy oral microbiome, nitric oxide levels plummet. This leads to tight blood vessels, poor oxygen delivery, low energy, impaired recovery, and increased cardiovascular risk. Most people struggling with fatigue, high blood pressure, chronic inflammation, or slow healing never realize that one of the root causes may be right in their mouth. The oral microbiome and the gut microbiome are deeply interconnected. They share microbial species, immune pathways, and inflammatory markers. When the mouth becomes inflamed, the gut follows. When harmful oral bacteria dominate, they travel down the digestive tract, disrupt the stomach's protective acidity, and contribute to gut dysbiosis. This microbial imbalance increases intestinal permeability, what we call leaky gut. Once that barrier weakens, toxins, pathogens, and food particles slip into the bloodstream, triggering systemic inflammation. The immune system becomes overloaded, constantly responding to threats that should never have escaped the gut in the first place. This is how gum disease becomes joint pain, how tartar becomes brain fog, how bleeding gums become autoimmune flare-ups. There is always a cause, an defect chain, and it often begins in the mouth. Every time you swallow, you send around 1 trillion oral bacteria into your gastrointestinal system. If those bacteria are healthy, they reinforce the integrity of the gut lining and support beneficial strains such as lactobacillus and bifidobacteria. If they are unhealthy, they introduce pathogens like P. Gingivolis fusobacterium, or S, mutants into the gut environment where they ignite inflammation, increase gut permeability, and damage the mucous barrier. People spend years taking probiotics, eliminating foods, or trying gut repair protocols, without knowing that their oral microbiome is seeding the gut with the very organisms causing the damage. Another critical function of the oral microbiome is the regulation of digestive enzymes. Salivary amylase and lipase begin carbohydrate and fat digestion in the mouth. When the oral microbiome becomes imbalanced, these enzymes become less effective. Food arrives in the stomach insufficiently broken down, placing a greater burden on the stomach and intestines. This leads to bloating, acid reflux, fermentation, gas, nutrient malabsorption, and intestinal irritation. The gut is forced to compensate for the mouth's failures, and over time, this contributes to inflammation and impaired gut function. Again, if the mouth is wrong, the gut cannot be right. Your immune system also depends heavily on oral signaling. The mouth contains immune receptors that detect pathogens and send instructions to the rest of the body on how to respond. A healthy oral microbiome sends accurate, calm, and controlled signals. A dysbiotic mouth sends alarm signals constantly. This leads to immune overactivation, chronic inflammation, and increased vulnerability to infections. Many modern conditions, chronic fatigue, autoimmune disease, cardiovascular disease, neuroinflammation, can be traced back to low-grade oral inflammation that has gone unaddressed for years. The science is clear. Oral pathogens are found in arterial plaque, joint tissue, the brain, and even in cancers. Once the mouth becomes a source of inflammation, that inflammation spreads everywhere. Despite its importance, the oral microbiome is assaulted daily by habits people mistakenly believe are healthy. Antibacterial mouthwash wipes out beneficial bacteria responsible for producing nitric oxide. Fluoride-containing toothpaste, alcohol-based rinses, sugary snacks, constant grazing, dehydration, and even aggressive brushing erode the microbiome and inflame the gums. These habits don't just damage the mouth. They set off a cascade of inflammation throughout the entire body. This is why so many patients never fully heal despite diets, supplements, or gut repair programs. They have not addressed the first barrier, the first defense, the first ecosystem that determines the health of everything downstream. Healing always begins in the mouth because the mouth is where digestion begins, where immune signaling begins, and where inflammation begins. If you restore the oral microbiome, if you bring back the bacteria that regulate nitric oxide, protect the gums, support digestion, and communicate with the gut, the entire system becomes calmer, stronger, and more resilient. When you repair the mouth, the gut heals more easily. The immune system becomes more balanced. Inflammation settles, energy rises, because you have finally addressed the true upstream cause. Most people assume their oral microbiome becomes damaged only when they get a cavity or visible gum disease, but the decline starts long before that. The destruction begins with everyday habits so normalized that no one questions them. Yet these are precisely the practices wiping out the protective bacteria your body depends on. Fluoride toothpaste, antibacterial pastes, and whitening formulas are the first culprits. They are designed to sterilize, not support, the microbiome. You cannot sterilize a living ecosystem without causing collateral damage. These products kill beneficial nitrate, reducing bacteria, inflame gum tissue, weaken the mouth's natural defenses, and allow pathogenic strains to take over. What looks like hygiene is often a daily assault on your most important barrier against inflammation. Then comes mouthwash, one of the most damaging habits of all. Alcohol-based and chemical mouthwashes obliterate oral bacteria in seconds. Yes, they temporarily mask bad breath, but they create far worse problems underneath. When you wipe out the bacteria that convert nitrates into nitric oxide, your blood pressure rises, your energy dips, your circulation worsens, and your immune system weakens. Studies show that just 1 week of antibacterial mouthwash can significantly reduce nitric oxide levels, and yet people are encouraged to use it twice a day. This is not healthcare, this is chemical warfare inside the mouth. Diet plays an equally destructive role. Sugar feeds harmful bacteria that produce acids, toxins, and inflammation. Processed foods strip the saliva of minerals needed to protect teeth and gums. Seed oils and ultra-processed fats disrupt microbial communication and increase oxidative stress. Acidic drinks, sodas, energy drinks, flavored waters, fruit juices erode enamel, inflame gums, and create an environment hostile to beneficial bacteria. And then there is dehydration. A dry mouth is a dying microbiome. Saliva is the transport system for enzymes, minerals, immune factors, and beneficial microbes. When you don't drink enough water or rely on caffeinated drinks all day, you suppress saliva production and allow harmful bacteria to flourish. Even breathing habits can destroy the oral microbiome. Mouth breathing dries out the mouth, reduces oxygen levels, increases acidity, and weakens saliva's protective effects. This sets the stage for gum disease, cavities, bad breath, and chronic inflammation. People who wake with a dry mouth, drool, snore, or breathe through their mouth during the day are continually damaging the oral environment and undermining their entire microbiome without realizing it. The tragedy is that most people ignore the early warning signs. They see them as annoyances, not symptoms of a deeper imbalance. Bad breath is not a hygiene issue, it is a microbial imbalance signaling fermentation and toxin production. Bleeding gums are not normal when brushing. They are chronic inflammation and bacterial overgrowth. A white, coated tongue is a clear indicator of dysbiosis, fungal overgrowth, and stagnation in the digestive tract. These signs are your body shouting that your oral microbiome is under attack, but the symptoms reach far beyond the mouth. Digestive issues such as bloating, reflux, constipation, and food sensitivities often originate from poor oral bacterial balance. If the bacteria responsible for initiating digestion are damaged, the entire digestive process becomes inefficient, causing irritation down the line. Brain fog is another overlooked sign. Inflammatory bacteria from the mouth enter the bloodstream and affect the brain, impairing focus and memory. Cravings, especially for sugar or carbohydrates, are driven by dysbiotic bacteria demanding their preferred fuel. Chronic sinus problems often begin as oral bacterial imbalance spreading into the nasal passages. And poor immunity, frequent colds, slow healing, recurring infections reflects an oral microbiome that can no longer modulate immune signaling effectively. In clinical practice, these symptoms often appear together, creating a pattern that is easy to recognize once you know what you're looking for. The mouth becomes a factory for inflammatory molecules. These molecules travel throughout the body, affecting circulation, hormonal balance, mitochondrial function, and immune regulation. Patients come in with fatigue, digestive distress, headaches, joint pain, or stubborn inflammation. And the root cause is often microbial imbalance in the mouth, long overlooked, never addressed. What makes this so concerning is how easily the oral microbiome can be damaged and how few people realize the connection. They buy toothpaste promising protection, a mouthwash promising freshness, and foods marketed as healthy but laden with sugars and seed oils. They breathe poorly, hydrate poorly, eat frequently, and never give the mouth a chance to restore itself. And yet they wonder why their gums bleed, why they feel inflamed, why they have cravings, why their digestion feels off, and why their immune system feels sluggish. Once you understand the oral microbiome, the picture becomes clear. These symptoms are not isolated problems. They are the predictable consequences of daily habits that undermine the body's first protective barrier. When you begin to recognize these signs for what they are, warnings of microbial imbalance, you can finally address the true cause rather than chasing symptoms. And when you repair the oral microbiome, the improvements ripple through the entire body: clearer sinuses, better digestion, sharper cognition, calmer inflammation, more stable energy, and a stronger immune response. Everything becomes easier to heal because you have stopped the constant upstream damage and started supporting the system where health truly begins. Damage to the oral microbiome never stays confined to the mouth. It initiates a cascade of dysfunction throughout the entire body. Every time you swallow, you send billions of oral bacteria into the gastrointestinal tract. If those bacteria are healthy, they support digestion, enhance nutrient absorption, and reinforce gut integrity. But when the oral microbiome is dysbiotic, you are constantly seeding the gut with inflammatory organisms that do not belong there. Pathogens such as *P. Gingivolis *, Fusobacterium nucleotum *, and *Streptococcus mutans * travel from the gums into the digestive system, where they disrupt the delicate microbial balance essential for digestion and immune regulation. These bacteria produce toxins, enzymes, and inflammatory molecules that irritate the gut lining, weaken stomach acid, and contribute to a leaky, inflamed intestinal barrier. When harmful oral bacteria enter the stomach, they challenge the body's first defensive layer, stomach acid. But here is the problem: many people already have compromised stomach acid due to stress, processed foods, medications, and nutrient deficiencies. When the oral microbiome is damaged, digestion in the mouth becomes inefficient, meaning the stomach receives poorly broken down food. This forces the stomach to work harder, often failing to produce the acid levels required for sterilizing incoming pathogens. As a result, oral bacteria survive, migrate into the small intestine, and contribute to bacterial overgrowth, fermentation, bloating, and dysbiosis. The gut becomes inflamed, permeability increases, and toxins begin leaking into the bloodstream. Chronic bloating, food sensitivities, IBS-type symptoms, and reflux often stem from this upstream failure. Leaky gut is not a random occurrence. It is a predictable downstream consequence of oral dysbiosis. The toxins released by pathogenic oral bacteria weaken the tight junctions that hold the gut lining together. Endotoxins such as LPS lipopolysaccharides enter circulation, triggering systemic inflammation. Once LPS escapes into the bloodstream, it can reach any organ joints, skin, brain, liver, heart, and ignite chronic disease. Patients often chase the inflammation in these tissues without addressing the original source. This is the system's biology principle: upstream insults produce downstream symptoms. If the mouth is constantly delivering inflammatory bacteria and toxins into the digestive tract, the gut cannot heal, regardless of what diet or supplement protocol is used. The damage doesn't stop at the gut. Chronic oral inflammation has well-established links to cardiovascular disease. Pathogenic oral bacteria and their endotoxins have been found inside arterial plaque, meaning they contribute to the formation and progression of atherosclerosis. These bacteria create oxidative stress, damage the endothelial lining of blood vessels, and accelerate plaque instability. This is why people with gum disease have a significantly higher risk of heart attack and stroke. The mouth becomes a chronic source of inflammatory molecules that travel directly into circulation. This is not theoretical, it is observable biology. Blood sugar regulation is also profoundly affected. Inflammatory oral bacteria promote insulin resistance by activating inflammatory cytokines that interfere with insulin signaling. They also disrupt nitric oxide pathways, and nitric oxide is essential for glucose uptake into cells. When nitric oxide levels fall, cells become less responsive to insulin, blood sugar remains elevated, and metabolic dysfunction develops. People often assume their high blood sugar is purely dietary, but the mouth is a major contributor, especially when nitric oxide producing bacteria have been destroyed by chemicals, mouthwash, or poor diet. Autoimmune conditions frequently trace back to chronic oral inflammation. Oral pathogens can mimic human proteins, confusing the immune system and leading to cross-reactivity, where the immune system attacks both the bacteria and the body's tissues. This molecular mimicry is documented in rheumatoid arthritis, lupus, Hashimoto's thyroiditis, and multiple sclerosis. When gum disease is present, the immune system is in a constant state of activation, increasing the likelihood of autoimmune flare-ups. It is not possible to calm the immune system without calming the oral environment first. Fatigue is another downstream consequence. When the oral microbiome is damaged, nitric oxide production plummets. Nitric oxide is essential for mitochondrial energy production, blood flow, and oxygen delivery. Low levels mean poor circulation, low oxygenation, reduced cellular energy output, and chronic fatigue. This is often misdiagnosed as adrenal fatigue, when the true cause lies in the mouth. Furthermore, chronic inflammation from oral bacteria consumes enormous metabolic resources. The immune system requires vast amounts of energy, and when it is constantly activated by oral inflammation, fatigue becomes inevitable. The biological pathways linking the oral microbiome to whole body inflammation are not mysterious. They are entirely logical. First, oral pathogens release toxins that enter the bloodstream. Second, these toxins weaken the gut lining, allowing even more inflammatory substances into circulation. Third, nitric oxide production declines, impairing vascular health and reducing oxygen delivery. Fourth, immune signaling becomes confused and overactive. This creates a chronic, low-grade inflammatory state that affects every organ system. You see it as joint pain, brain fog, allergies, skin issues, hormonal imbalance, digestive distress, and frequent infections. These are not separate problems. They are connected by a single upstream imbalance. Once you understand the flow of biology mouth to gut to bloodstream to organs, the solution becomes clear. You must repair the source of the inflammation. A balanced oral microbiome protects the gut, supports nitric oxide production, stabilizes immune function, and keeps inflammation low. When the mouth is right, the systems downstream have a chance to heal. The first step in restoring the oral microbiome is to stop the daily assaults that keep it inflamed and imbalanced. You cannot rebuild a living ecosystem while simultaneously destroying it with chemicals, alcohol, and abrasive agents. So before adding anything, the routine begins with removal. Eliminate antibacterial mouthwash, fluoride toothpaste, whitening gels, foaming detergents like SLS, and harsh scrubbing. These do not clean the mouth, they sterilize it. And any ecosystem that is sterilized becomes overrun by the most aggressive inflammatory bacteria. Once you remove these chemicals, the mouth is finally able to begin healing. The most effective way to cleanse the mouth while preserving beneficial bacteria is a simple, science-backed practice. Oil pulling with cold, pressed coconut oil. Coconut oil contains lauric acid, which selectively targets harmful bacteria such as Streptococcus mutans without damaging beneficial nitrate-reducing strains. It binds to bacterial membranes through a process called saponification, effectively pulling pathogenic organisms out of the oral biofilm. Oil pulling also reduces inflammation in the gums, increases saliva production, and supports wound healing. The technique is straightforward. Place 1 teaspoon of coconut oil in your mouth, swish slowly and gently for 5 to 10 minutes, then spit it out. Do not gargle, do not swallow. This single practice performs a deep clean of the mouth without harming the ecosystem that protects you. Immediately after cleansing, you rebuild. The fastest way to repopulate beneficial oral bacteria is tongue scraping, but the reason is not what most people think. A tongue scraper does not just remove buildup. It exposes the papillae where healthy bacteria live and reproduce. When the tongue is coated with debris, dead cells, and overgrown pathogens, beneficial bacteria cannot reattach and colonize. By scraping gently from back to front, you remove the barrier preventing recolonization. This simple step accelerates microbial recovery faster than any probiotic. The next technique is the one most people have never heard of, yet it is the most powerful: feeding nitrate, reducing bacteria with dark leafy greens, beetroot, arugula, celery, and herbs. These foods supply nitrates that beneficial bacteria convert into nitric oxide. This molecule improves blood flow to the gums, lowers inflammation, enhances immune function, and supports mitochondrial energy production. When you chew these foods raw, you directly nourish the oral microbiome. This is not a gut process, it begins in the mouth. Chewing real foods is the fastest way to regenerate beneficial species. Natural antimicrobial foods also play a critical role. Raw garlic, ginger, cloves, and green tea contain compounds that reduce harmful bacteria without destroying beneficial strains. These foods work synergistically with saliva, the body's built-in defense system, to control pathogens. A small amount daily is enough. There is no need for expensive formulas. Saliva itself is one of the most important components of the routine. Without saliva, the oral microbiome cannot survive. Hydration, proper breathing, and mineral-rich foods determine saliva quality. To protect the oral ecosystem, adopt nasal breathing as the default. Mouth breathing destroys the microbiome by drying the oral tissues, increasing acidity, and reducing oxygen availability. People who wake with dry mouth, snore, or find themselves breathing through their mouth during the day must correct this immediately. Nasal breathing restores moisture, stabilizes pH, and supports beneficial bacterial growth. A simple approach is to keep the lips sealed consciously during the day and train nasal breathing at night by elevating the head slightly and avoiding heavy meals before bed. Hydration is equally essential. Drink water steadily throughout the day, especially before and after meals. Avoid constant sipping on acidic drinks like coffee, tea, or flavored water. These beverages erode enamel and create an acidic environment harmful to beneficial bacteria. Hydration supports saliva flow, which delivers enzymes, minerals, and immune factors that rebuild the oral ecosystem. The routine also requires removing grazing and constant snacking. Every time you eat, mouth acidity shifts and bacteria feed on leftover sugars and starches. Giving the mouth 3 to 4 hours between meals allows pH to recover and beneficial bacteria to stabilize. This one change dramatically reduces gum inflammation and bad breath. This routine outperforms toothpaste, probiotics, and mouthwash because it aligns with how the oral microbiome actually functions. Toothpaste offers superficial cleaning but damages the microbial environment. Probiotics rarely colonize the mouth because the conditions are not supportive. Mouthwash destroys the very bacteria responsible for producing nitric oxide and regulating inflammation. The routine described instead cleans without sterilizing, feeds bacteria rather than killing them, restores saliva production, improves oxygenation, and eliminates the chemical triggers causing chronic inflammation. This is a system, not a product. It works with biology, not against it. When practiced consistently, people see reductions in gum bleeding, improvements in breath, better digestion, lower inflammation, and higher energy because they have repaired the foundation upon which the entire microbiome depends. Healing the oral microbiome is not only about cleansing and removing harmful influences, it also depends on what you feed it and how you support it through daily habits. Nutrition plays a critical role in strengthening oral tissues, enhancing saliva quality, and providing the raw materials for beneficial bacteria to thrive. Polyphenols, found in foods such as green tea, blueberries, cranberries, and herbs like rosemary and clove, act as natural antimicrobials while reducing gum inflammation. They selectively inhibit harmful species without destroying nitrate, reducing bacteria, providing both protection and support for recolonization. Incorporating these into meals or as teas supports oral health while simultaneously supplying antioxidants that circulate systemically, lowering overall inflammation. Nitrate-rich vegetables are essential for restoring nitric oxide pathways, which are intimately connected to oral and systemic health. Dark leafy greens, arugula, beetroot, celery, and spinach supply dietary nitrates that oral bacteria convert into nitric oxide, improving blood flow to the gums, reducing inflammation, and supporting immune function. Chewing these foods raw activates saliva, which both lubricates oral tissues and distributes minerals and enzymes that strengthen enamel and gum integrity. Saliva is the body's natural repair mechanism, and stimulating its production through careful mastication is a simple but often overlooked strategy to accelerate healing. Minerals are equally important. Calcium, magnesium, phosphorus, and trace elements like zinc and selenium support enamel repair, gum tissue resilience, and enzyme function within the microbiome. Eating mineral-dense foods such as nuts, seeds, leafy greens, bone broth, and mineral-rich water ensures the mouth receives the building blocks it needs. These nutrients also support collagen formation, a key component of gum and connective tissue repair, ensuring that tissues are not only free of inflammation but structurally robust. Vitamin C, proline, lysine, and glycine all contribute to collagen synthesis and should be included daily, whether through whole foods or targeted supplementation, to reinforce the foundation of oral health. Anti-inflammatory fats are another cornerstone. Omega-3 fatty acids from fatty fish, flax seeds, chia, and grass-fed animal products reduce local gum inflammation, modulate systemic immune responses, and support cell membrane integrity. These fats are critical in preventing the overactivation of the immune system in response to oral pathogens, allowing the microbiome to recover without constant inflammatory interference. Combined with polyphenols and minerals, they create an environment where beneficial bacteria can repopulate efficiently, and tissue repair occurs more rapidly. Lifestyle factors accelerate oral healing in ways that nutrition alone cannot achieve. Nasal breathing maintains moisture, optimizes oxygen levels in the oral cavity, and preserves pH balance, all of which are essential for bacterial health. Mouth breathing, conversely, dries tissues, increases acidity, and favors harmful species. Proper hydration ensures that saliva production remains optimal, carrying enzymes, minerals, and immunoglobulins to the gums and teeth. Drinking mineral-rich water throughout the day, especially before and after meals, supports both microbial balance and tissue repair. Sunlight exposure is another overlooked tool. Ultraviolet light on the skin stimulates nitric oxide release, complementing the nitric oxide pathways in the mouth. This improves circulation to oral tissues, enhances oxygenation, and supports the body's natural anti-inflammatory mechanisms. Even brief daily sunlight exposure can create systemic benefits that accelerate oral recovery. Chewing whole foods thoroughly is deceptively powerful. The mechanical stimulation of chewing increases saliva flow, distributes nutrients, and massages the gums. It also ensures that raw vegetables reach the areas of the mouth where nitrate reducing bacteria reside, directly feeding them and improving their capacity to support nitric oxide production. Combining deliberate chewing with raw, nitrate-rich, polyphenol-dense, and mineral-rich foods creates a positive feedback loop: stronger tissues, healthier bacteria, better nitric oxide levels, lower inflammation, and faster systemic recovery. These strategies work in concert with oral cleansing routines and microbiome restoration techniques. The body heals best when biology is supported holistically, feeding beneficial bacteria, providing structural nutrients for tissue repair, lowering inflammation, optimizing nitric oxide pathways, and maintaining an environment conducive to microbial stability. Consistent application of these nutritional and lifestyle interventions ensures that oral healing is not just temporary but durable, providing a foundation for improved digestion, immune function, and whole body health. Begin the day with a gentle oral detox. Before eating or drinking anything, start with oil pulling using 1 teaspoon of cold, pressed coconut oil. Swish slowly and deliberately for 5 to 10 minutes, making sure the oil reaches all areas of the mouth, then spit it out. Follow immediately with tongue scraping, moving from back to front to remove debris. Expose the papillae where beneficial bacteria live and stimulate saliva production. Rinse briefly with warm water if needed, but avoid any chemical-based toothpaste or mouthwash. Drink a glass of mineral-rich water to rehydrate and support saliva flow, then practice a few minutes of conscious nasal breathing to moisten tissues and improve oxygenation. Breakfast should consist of nitrate-rich, polyphenol-dense foods. A small salad of arugula and beetroot, or a smoothie containing leafy greens, berries, and a pinch of ginger will feed nitrate, reducing bacteria and supply antioxidants. Chew thoroughly to maximize saliva production and nutrient delivery, and avoid processed foods, sugary cereals, or acidic drinks. Sip water steadily through the morning, ensuring the mouth remains moist, which maintains pH balance and supports beneficial bacteria. Avoid grazing between meals. Allow 3 to 4 hours between eating to give oral tissues and bacteria time to stabilize. Midday, repeat a brief oral rinse with plain water after lunch to remove food particles and maintain saliva flow. Include natural antimicrobial foods during the meal, such as cloves, garlic, or green tea, which reduce harmful bacteria without damaging protective strains. Focus on chewing thoroughly, particularly with raw vegetables, nuts, or seeds, to mechanically stimulate the gums and distribute nutrients evenly across the oral surfaces. Continue nasal breathing throughout the day, correcting any tendencies toward mouth breathing, particularly during physical activity or conversation. Afternoon hydration remains critical. Drink water or herbal teas that are non-acidic and non-caffeinated. Avoid snacking on sugary or processed items, as constant carbohydrate exposure feeds harmful bacteria and inhibits recovery. If energy dips, choose nitrate-rich vegetables or a small portion of healthy fats like avocado or nuts to stabilize blood sugar and support oral and systemic healing. Dinner should again prioritize nitrate-rich, mineral-dense foods and anti-inflammatory fats. Chew thoroughly, allowing the mechanical action to stimulate saliva and massage the gums. Finish the evening with a final oil pull, followed by tongue scraping, to remove bacteria accumulated throughout the day. Reduce inflammation and prepare the mouth for restorative overnight processes. Brush only if absolutely necessary, using a soft, non-chemical brush and water, but avoid foaming, fluoride, or antibacterial pastes. Finish with nasal breathing and a brief hydration sip to maintain moisture through the night. Over the first 24 hours, most people will notice subtle but measurable changes: a reduction in morning, coated tongue, slightly fresher breath, and a sensation of gum comfort. By 7 days, inflammation should visibly reduce, saliva flow improves, taste perception heightens, and mild digestive comfort emerges as oral bacteria begin supporting gut function. By 14 days, patients commonly report marked reductions in gum bleeding, improved breath, better digestion, increased energy, and an overall sense of systemic calm, a reflection of decreased low-grade inflammation. This routine is not about cosmetics or temporary fixes. It is about restoring the oral microbiome as the foundational barrier for whole body health. As the mouth stabilizes, the gut receives beneficial bacteria instead of inflammatory pathogens. Immune signaling becomes balanced, nitric oxide pathways resume optimally, and systemic inflammation diminishes. Energy rises, focus improves, and chronic complaints such as bloating, brain fog, and fatigue start to resolve. The mouth is no longer a source of disease but a gateway to vitality. When you consistently apply this routine, the benefits ripple throughout the body, supporting gut integrity, strengthening immunity, and laying the groundwork for long-term health and resilience.